excited to have a unit established to offer this service, and we want to know more about what she does with her team in the outfit. So my boss and colleagues, you are welcome to the show.
Thank you.
You are also all welcome. Be seated comfortably and enjoy the discussions. Remember, you can send in your comments, your questions online when the need be. And we thank you so much to our online guests for always joining our webinar series. We appreciate your participation. So quickly, I want to begin with Dr. Philip Amo. Once again, you are welcome.
Thank you.
Can you give us briefly an overview of international vaccinations? Why is there even the need for international vaccinations at all?
Thank you. And international vaccination has become very, very important in our world today. As you may know, global travel and globalization and international connectivity is on extreme rise. Data tells us that between January 2025 to yesterday, 29th of October 2025, we had between 1.6 to 2 billion human beings moving from one country to the other to interact with fellow human beings in business, in for academic purposes, for work, for pilgrimages, and for so many other reasons. So this level of human mixture has its unintended consequences. Global travels are very important for the progress and business and cash in this world. But it has unintended consequences when human beings from one location, geographical location, mixes with another human being in another geographical location. And the mixing up of human beings for all this legitimate reason produces unintended effects like sharing of infection, spread of infection. So the international vaccination services are public health interventional modalities put in place to protect, first of all, to prevent international spread of diseases associated with travels and mixing of human beings of all kinds. Then also, also to protect the traveler who is traveling for very legitimate reason. He's not traveling to go and share diseases or acquire diseases. They go there to do business and other, reasons. And to protect them from, the unintended effects of acquiring infection, vaccinations have become very important. Another reason why international vaccinations are very critical nowadays is to fulfill the international health regulation requirement.
Thank you for that.
In 2005, 194 WHO countries came together and adopted a system. And this system is to ensure that human beings moving across international borders are protected from infections. And the international health regulation requirement, one of the key among them is to ensure that every traveler is given the needed vaccination protections and have evidence of the vaccination. And the typical one is the yellow fever vaccination. So the benefit of vaccination in our modern time cannot be overemphasized. As long as there is increased international travel and mixing of human beings, the unintended consequences will certainly be increase in the spread of infection. And the way we protect people from being infected or harmed or transmitting diseases is through the international vaccination services. So these are very critical for now. Also for surveillance purposes, as vaccinations are given to travelers. Records are taken. And this becomes very important when we pull them into the database, global database, ensuring that large numbers of human beings are protected against a particular disease, causing what we call herd immunity, thereby protecting our global world, that is our global village. So
right.
The benefits are enormous.
Okay, thank you so much. So my understanding is that there are localized infections in countries, and because we don't want to spread these infections to other parts of the world when we mess up, we use vaccination as an infection control measure. Really, basically, that's my understanding of what you are saying.
Exactly so.
Thank you, Dr. Mo, for that. So quickly, I'll move to my colleague Pat, who does a lot of the vaccinations and all that. I'll just kindly give us, what are some of the common vaccinations that as a traveler, I would need to take to be able to go outside of the shores of the country?
Thank you for the question. So, aside the popular one that you know, yellow fever, we also have other ones like MMR, that you know it is measles, mumps, and rubella. We have vaccines for chickenpox, vaccines for tetanus, diphtheria, pertussis, vaccines for hepatitis A and B, influenza, for meningitis, for pneumonia. There are a lot. And these vaccines are given based on the itinerary of the traveler in the duration of their stay.
Yeah, so I was going to ask, do I have to take all these vaccines before I travel out of the country, or there are some that I need to take and then others that really it doesn't matter? Doesn't matter that we have to take all of them, or there are some specific situations that would have me take some specific vaccines?
So for short duration visits, like visit to family and friends for a limited time, you don't need many vaccinations.
Okay.
You have to take yellow fever as the mandatory one, and that will be enough to take you and then bring you back. But if you are going for a long-term stay, such as for academic, going to school, or going to work abroad, then you may need to take extra vaccinations for prolonged stay. We will add measles, mumps, rubella. We will add chickenpox. We will add Tdap. And all these have their schedules that I would like to explain briefly.
Okay, go ahead.
So with the measles, mumps, and rubella vaccine, it is taken twice, 1 month apart. 1 month apart. And also, travelers who are supposed to do a mantle skin test alongside the MMR vaccination can delay the skin test and take it after they have taken the MMR, because the MMR can have an impact on the results of the mantle skin test. It is not good for people who are pregnant and also lactating mothers, for immunocompromised and also immunocompressed patients. They cannot take the MMR vaccine. Then we have also this important vaccine called varicella, given to prevent chickenpox.
Okay.
And with this vaccine, we also give it 2 times, 2 doses at 1 month interval. But in case a person had already had a severe form of chickenpox, then they can be exempted from taking this varicella or chickenpox vaccine. They are given the option to either use their past infection record or their 2 immunization doses, documentation for travel. So we have that available for travelers.
Right. Thank you. So you were saying that one of the vaccines, we have to take it 1 month apart. Which one was that? The MMR, right.
Chickenpox vaccine.
Right. So if I am traveling and I have just 1 month to go, you said that I need to take the vaccines 1 month apart, but I have just 1 month to be here. Can anything be done about that situation, or then it's not possible?
So you can take the first dose of the vaccine, then you can travel with this. You can continue there as you travel, because there are also other clinics where you are going.
So the first dose allows a traveler to be able to leave the shores of the country.
Yes,
correct. Okay, thank you so much for clarifying that for me. Abigail, I want you to perhaps educate us on the protocols that Korle Teaching Hospital uses, also merging it with the international guidelines. So tell us, what is the protocol that you apply in the vaccination set as a disease control officer, and then how does that align with international guidelines for international vaccination?
Okay, so what I can say to that is the hospital employs multiple strategies from the foreign agencies. I would say the hospital employs multiple strategies to ensure that our vaccination services align with the international guidelines. That is monitoring the authoritative sources, CDC, international health regulations, and then WHO. They have these guidelines that the hospital, as Korle Teaching Hospital, goes by these guidelines. Aside that, the hospital also works together with the pharmaceuticals that supplies us the vaccine. We make sure they supply us the current vaccines, and then also make sure the cold chain is maintained from the supplier to the recipient. Yeah, that's what I can say about it.
Right, thank you. Thank you for that. So I was wondering, could there be a situation where we would refuse to give a traveler a yellow card? And what situation would that be then? I think any of you can pick an answer.
Okay, so what I can say about that is, before a traveler will be refused a yellow card is when the traveler doesn't want to take the vaccine. Before you get a yellow card, you need to take the yellow fever vaccine. Aside your recommended vaccines, maybe it depends on the country you are going. So some countries have their own specific vaccines they require. So aside that, you still need to take yellow fever before you can even get the yellow fever card for us to give you the specific vaccines the countries need and then enter them into the card. So if you refuse vaccination, then you can't get the card.
Right.
Or you can take the yellow fever before or previously before you come to Korle or the vaccination center, where you have the local yellow card. So if you have the local yellow card, that proves that you've taken the vaccine already. This is how the local yellow card is. So if you have this proof where your name and details are being entered, we just transfer it into the international yellow card for you. But aside that, this is the international yellow card. It's in the booklets form where all vaccines can be entered into it. So if you have your proof of this, or you take the vaccine with us, we'll give you this. That's what I can say.
But since you're the doctor, I just want to ask, could there be a situation where someone may have a contraindication for taking the yellow fever vaccine but will have to travel? If there can be a situation like that, how do you go about it if the person needs to take an international travel?
Yeah, thank you very much. That's a very important question. We are humans, and one size fits all is not possible for all the human beings we have. International health regulation mandates that anyone traveling should take yellow fever. But for some people, they have reactions. Very few people, less than 0.5%, have some reaction towards the yellow fever vaccine. And these reactions could be a bit severe. And we know that these people who have reactions to egg, for example, when they eat egg, they react violently, or they've experienced some serious vaccination reactions that warrant them to be admitted in hospital or to be seen by a medical professional. Under those circumstances, we are able to examine and assess the situation carefully. When we have enough evidence and proof, we can issue a medical exemption or waiver certificate or form. And that is a very important document for the few people who, for medical reasons, cannot take the international yellow fever vaccine. And let it be known that if you have such a situation, you must have reported to us about a month or two before you travel, so that we can go through the processes and ensure that truly you have reaction to to the yellow fever vaccine. What we will not take is all the excuses, fear, hesitancy, manifest. Somebody comes and say, look, I have a reaction to yellow fever vaccine. When I eat egg, I react violently. We have no proof of that. It will be difficult for us to give you the medical waiver or the exemption, vaccine exemption form. So please, if you know you have such unusual reactions to vaccine, you should have reported at least 2 months or maximum 1.5 months to time, so we can go through the processes as required by international rigor to ensure that truly you have some significant reaction to the yellow fever. And once we produce and give you that exemption form, it is legitimate and it is accepted internationally.
All right, thank you so much. I hope you are enjoying the conversation so far. I want to remind you that this webinar is brought to you by the Public Relations Unit of the Korle Teaching Hospital and production by Mawu the Care Productions. We are very, very grateful to you. Thank you so much. We are still on. If you have any questions, if you have any comments, kindly put it in the chat box and we'll read them out for you. So I get back to my panel. I want to ask, at the KVIC, is it only international vaccination that you do, or there are some other services that you offer in that office? But
okay, so we have an outreach program where we accept invitations to anywhere. Corporate bodies can invite us, churches, schools, marketplaces, communities, anywhere to come and vaccinate their staff or people for them. We accept those invitations. We do also international assistance program, and then travel health. People who come to us for health in terms of what they need to know in the region that they are going to, in terms of the prevailing conditions there, food and water issues, respiration issues, vector-borne, anything that they want to know, first aid setup before they pack. We are able to assist them by help of our doctors to know exactly what they need to do before they travel to their destinations.
Thank you so much.
Let me add.
I'm actually come. So let me ask you that when you speak, you add this to it. Pat mentioned that you do travel assistance program, and then you also educate clients that come to you about some health risk in various regions. Dr. Amo, if you can speak to this on behalf of the team for us, what are some of the risks that can be found in the various regions that travelers must be aware of? And then what kind of assistance can travelers also get apart from the international vaccinations that they assess at the unit?
Right. So critically, travelers travel to various destinations across the world. Some of the destinations are known to have certain health risks. For example, if you take Africa, you take Brazil or Southern American countries, we are known to be high-risk regions for yellow fever. Right? So when you are going to those countries, one of the services we provide is to scan the countries you are going, the known risk. We would help you to get the appropriate vaccines. We also ensure that the countries you are going, they also have their standards or the vaccines, recommended vaccines they require for every traveler. We are able to scan through that, get all those information, and make sure that when you come to the public health department to vaccinate, we make sure that the vaccines you get fulfill the international health regulation requirement and that of the country you are going to. The other aspect is that we also look out for outbreaks. Every now and then, some areas have outbreaks. For example, there used to be Zika outbreak here, H1N1 outbreak, influenza outbreaks in certain parts of the world. Now, WHO comes from time to give instructions. If they declare public health emergency of international concern, they will give the particular conditions that must be mandatorily vaccinated for before the traveler go into those regions. So we get those information from the WHO as well. And then most importantly, we are following current trends in pandemics and epidemics and all kinds of outbreaks in certain pockets of the world. That's the essence of coming to Korle vaccination center, because the experts are here. We are able to scan around, contact the embassies and the health professionals in those countries, and make sure that we give you the up-to-date information that is required. The other service that is critical is the travel assistance services. Some people have some medical issues. They may travel and suddenly fall into critical medical emergency. They don't know anybody, in those countries, so on. So as part of our, interaction with a traveler, when a traveler is at risk of, coming down with those serious and significant illnesses, we are able to connect them to help whilst in Ghana and put them in on appropriate insurance, so that when they get there and there's trouble, the insurance can take care of them, and sometimes medical evacuation back to Ghana will be necessary. So those are travel assistance services we provide in addition to the vaccination and the travel help. The other thing I want to mention is every country is unique in a way. Some countries have this problem of typhoid infections. Rampant through food, through water, bacillary dysentery, travelers diarrhea. Others too are traveling to rural areas where they will encounter wild games and so on. The vaccination requirement is slightly different for whatever is pertaining to the destination country. And therefore, we are able to titrate and moderate exactly what the requirement is and give the traveler the adequate protection he or she will require, even if the country they are going or the destination country had not raised any red flag. We are able to pick the signal and ensure that they are protected, and so they can go do whatever they want to do and return back to their family joyfully.
Wow, wow, wow. So what a huge service that you are doing in that outfit. I am impressed. Thank you so much. So then, Abigail, what kind of information would we need from a traveler, and what documentations do you maintain there to, assist them whilst you are also vaccinating them for their travels?
Okay, so the documents that we will need before you be given an international yellow card is you present your passports. Anybody who is traveling goes with a passport. So you present your passports. If you don't have it, that is if it is not ready. There are some that comes and their passports are not ready, but they need to be vaccinated. So you can also come with your Ghana card, because now Ghana card is accepted everywhere. So you can bring your Ghana card, or because we want the information, that is your name, date of birth, to align with what we will write on the international yellow card. We don't want a situation whereby you give us 2 names and then on your Ghana card or your passport, you have 3 names. If you get to the airport and it doesn't tally, they will not allow you to go. So we always recommend that you present us with your passport or your Ghana card so that we can write the details on the passport or on the Ghana card straight into the yellow fever vaccination card. And then some also comes with documents. It depends, that is from where you are going. If you are going for school, let's say you are going to school abroad, they have these vaccines they require you take. You come with those documents. We also assist you by filling them for you, making sure we stamp and then sign so that the school will also accept it. So whatever being transferred into the yellow card will also be transferred onto the sheet based on what they require. That's what we need.
Okay, so do I need a visa in my passport before I can have an international vaccine?
Not at all. All that we need is that you have your passport available or your Ghana card. We don't need your visa for anything.
Okay, I thought perhaps you want to use it as a proof that indeed I am traveling outside the country. All right, thank you so much, Dr. Amo and Abigail. Pat, I want you to share with us, what are some of the experiences of your patients and how do you even prepare them for vaccines? You know, most of us, especially the men, they are afraid of even that small needle that you use. What has been some of your experiences with patients, some trying to convince you perhaps even with money, that could I just keep the small injection and then still get the yellow card? And how have you managed such situations?
Thank you for the question. We experience this daily. People come and they only want the card.
And not the vaccine. They are not interested in the protection.
Exactly.
They want the proof.
They want the proof. So we always encourage them and convince them to take the vaccine before getting the card. Because we believe that having the card only will not save you when you are exposed to a disease. Vaccinations will save you. So we have a way of convincing our clients to come to terms with taking the vaccinations. We also have very skilled, experienced staff who give painless injections. Only in Korle Bu.
Only in Korle Bu.
You can get painless injections from our experienced, very seasoned and friendly, dedicated staff, always committed to help our clients to get what they need. Also, we have a very short waiting time. When you come to our facility, there's no queue. We are really eager to help you and to finish with you, so we don't have prolonged waiting time. When you come instantly, you're attended to, and you can go and do your daily business. We also have very affordable prices compared to other hospitals around. We have the most competitive prices. And also, we have all the vaccines available. It's a one-stop destination for all vaccines. We don't run out of vaccines. So it's a very holistic setup that we are running.
Right.
Excellent services for.
Thank you, thank you. Thank you so much for that. We'll be going on a short break in the next 5 minutes, but before we do that, I want to ask, post-vaccination, what do you do with them? Do people come, vaccinate, and then once you are done with their vaccination, they have paid, that is the end of the service they receive for you? Or after one has vaccinated, what do you do? Or what, support can be available to them? Any of the team members can answer this question.
Okay, so after vaccination, we counsel them that vaccines, every vaccine have its own side effects. And then being vaccinated and getting side effects is better than not vaccinating at all and getting the disease. So what we do is that we counsel them by letting them know that since there is a new thing that has entered your body, you feel pain because it's a needle. So pain is normal, but if in case the site swells or there is a swelling at the site, you can put an ice in a towel and then apply it on it for a while. We also tell them that in case it becomes severe or serious reaction, you can come back to the facility where we have specialists who will take care of you, and it's free. Yeah, those are some of the...
Post-vaccination care is free.
It's free, yeah.
Right. Thank you so much. Someone was asking online, John Japan was asking, do you do international vaccination for polio, MMR, DTaP, tetanus, and BCG. I think that when you were talking, you addressed that. So we will go for a short commercial break, and then when we resume, we will continue with our discussion. Thank you for joining us so far.
Thank you. Hello, I'm Abigail Owusu, Disease Control Lead, Public Health. Vaccination is important. It protects individuals and communities against illnesses. It also prevents outbreaks. That's why I want you to join us on our Korle webinar series on all our social media platforms. This Thursday, 4 p.m. prompt, as we deliberate more on international vaccines. Thank you. Hello, I'm Abigail Owusu, Disease Control Lead, Public Health. Vaccination is important. It protects individuals and communities against illnesses. It also prevents outbreaks. That's why I want you to join us on our Korle webinar series on all our social media platforms. This Thursday, 4 p.m. prompt, as we deliberate more on international vaccines. Thank you. Hello, I'm Abigail Owusu, Disease Control Lead, Public Health. Vaccination is important. It protects individuals and communities against illnesses. It also prevents outbreaks. That's why I want you to join us on our Korle webinar series on all our social media platforms. This Thursday, 4 p.m. prompt, as we deliberate more on international vaccines. Thank you. Hello, I'm Abigail Owusu, Disease Control Lead, Public Health. Vaccination is important. It protects individuals and communities against illnesses. It also prevents outbreaks. That's why I want you to join us on our Korle webinar series on all our social media platforms. This Thursday, 4 p.m. prompt, as we deliberate more on international vaccines. Thank you. Hello, I'm Abigail Owusu, Disease Control Lead, Public Health. Vaccination is important. It protects individuals and communities against illnesses. It also prevents outbreaks. That's why I want you to join us on our Korle webinar series on all our social media platforms. This Thursday, 4 p.m. prompt, as we deliberate more on international vaccines. Thank you. Hello, I'm Abigail Owusu, Disease Control Lead, Public Health. Vaccination is important. It protects individuals and communities against illnesses. It also prevents outbreaks. That's why I want you to join us on our Korle webinar series on all our social media platforms. This Thursday, 4 p.m. prompt, as we deliberate more on international vaccines. Thank you. Hello, I'm Abigail Owusu, Disease Control Lead, Public Health. Vaccination is important. It protects individuals and communities against illnesses. It also prevents outbreaks. That's why I want you to join us on our Korle webinar series on all our social media platforms. This Thursday, 4 p.m. prompt, as we deliberate more on international vaccines. Thank you. Hello, I'm Abigail Owusu, Disease Control Lead, Public Health. Vaccination is important. It protects individuals and communities.
That short break. I encourage you to keep the conversation very engaging. So put in your comments, put in your questions in the chat box, and if it is very clear, let us know. If we don't understand something, yes, ask. That is why we are here, so that we can give you all the necessary information you need for you to make that informed decision anytime you want to travel. Okay, welcome back, my guests. Pat, I want you to clarify the question that was asked. Which of the vaccines do you give? So he's asking if you give vaccine for polio, MMR, DTaP, tetanus, and BCG.
Thank you for the question. So we have vaccines for MMR. As I mentioned, we give it 2 doses at a 1-month interval. We have vaccines for Tdap, teed up tetanus, diphtheria, and pertussis. It's a single dose for life. And the booster for the childhood DPT, that is given. We also have vaccines for polio, that is IPV. It's an injection taken once by the adults. But for BCG, it's only given at birth. So we don't give adults BCG.
Right. So BCG vaccine is given at birth. Adults are not given BCG. Thank you so much for that clarification. So in your experience, in your work, what are some of the misconceptions out there about vaccinations and international vaccination? Any of you can take that question here.
So many people have it in mind that the vaccines that they took during childhood are still potent and can protect them during their travel. This is not true, because all those vaccines that we take during childhood, they get used up by age 10 to 12 years. So during adult life, when you are traveling abroad, you need to take the adult doses to boost your immunity before you travel out. So you can't say that you have taken measles before, so you're not taking MMR. It's not right. So those vaccines are used up early in life before the adult life begins. Thank you.
Okay. Abigail, you wanted to add up to it?
I also want to add up to what she said. What I can say is, some also feel like they say, I'm going for a short period, so I don't need these vaccines. But what I want all of us to know is that even for a short period, vaccine-preventable diseases can be contracted within an hour or some hours, or even some days. So it doesn't matter how short it is for you, you still need to be vaccinated.
Right. Thank you. Dr. Amo, in your experience, have you come across any myths or misconceptions about international vaccination?
Yeah, some also have the idea that there's a conspiracy theory that some whites want to, or some people want to, eliminate the black race or make people impotent, infertile, all kinds of wild ideas. Some also go onto the internet and go and get conspiracy ideas. And then that's what they accept and they are moving with. When they come, they'll give all kinds of excuses for not having, but they want the card. But that is completely unacceptable. We cannot help you with that. Some also think that it is protocol. They are big people. They've been sent by some high official. So because of that, when they come, they can use their protocol to overrun the system. Therefore, there will be no need for them to take the vaccine. That also doesn't work.
Isn't it a difficult conversation? If someone in the high office has sent, how do you deal with that?
Yeah, in fact, I mean, we've had, even just last week, a very topmost person come. But you see, underpinning those issues is actually hesitancy and fear. But patience is here. She skillfully, took away the hesitancy. Within a matter of 10, 15 minutes, this big man who will not accept vaccine from anywhere, brought, his shoulders to be vaccinated. And to your surprise, to our surprise, he received the vaccine and never knew that
he had received it.
He didn't realize that the needle has started.
Interesting.
Because our nurses are so skillful. One nurse in our public health department have vaccinated over 6,000 to 10,000 people. So they've done the same thing over and over again. They can enter your skin easily without, you even feeling that you have had any vaccination at all. So all these myths are unfounded. Some say their friends have had it and has suddenly collapsed. And then others also say when they take it and they are traveling, there may be complications and so on. Please, all those fears are, untenable. Others also have a very interesting way They will say they will vaccinate, but not now, tomorrow. It's called procrastination hesitancy.
Yeah.
And they will do that until 2 hours before the flight. Then they will come asking for vaccination. Please, all those are untenable. Our people are well trained. Whatever the reason you have for fearing the vaccine, you come to us. Let's dialogue. Let's deal with it. And we put our professional career and life on the line for you. We'll give you post-vaccination support, anything, whether you are in the country or not. Our numbers are with you. And we'll give you all support. Be assured. Come over. Have your vaccination. There will be nothing, there will be no problem at all. So you can go and be protected. There's no point. People have traveled in the fear of COVID, went to another country when the COVID was on. They maneuvered their way. They did not receive the COVID from other institutions. They had a car, they traveled. And then on ICU, when they were in the intensive care dying, that was when they confessed to the doctors over there that they had a car without the vaccination. And
that's quite dangerous.
That's very dangerous.
So, I mean, on my way here, I was thinking that perhaps we needed the lawyer to be also on this discussion to give us the legal perspective of all this, and people who want to refuse vaccine but want to pay for yellow card and all that. And I mean, perhaps in future, we can also look at that aspect of it. But because you brought in COVID-19, and I know during COVID-19 we did quite a huge monitoring of post-vaccine reactions and side effects and all that. And I know most of the men, when we had to engage them for psychological support, their fear was that they would go impotent and all that. Post-COVID-19 vaccination, have you had any follow-ups with people coming in with such cases at your outfit, Dr. Amu?
You'll be surprised that, yes, when during the heat of the vaccination, let me inform the whole world that Korle Teaching Hospital Vaccination Center have vaccinated more individuals on COVID-19 vaccine than any institution. Over 67,000 human beings have had vaccination. Protocol, ordinary people, travelers, I mean, day, night, 24/7, we were at work. Now, we've had a number of reactions. Most of them were hysteria and fear of a new vaccine and new novel virus. But most of them were, after some time, dispelled and didn't amount to anything. Some people had a little fever, pain, discomfort, general malaise. That's the most common, and that is common with all the vaccines, most of the vaccines, and there are no complications. A few people, less than 0.2%, less than 0.2%. 0.2 is what? 2 in 100, isn't it? 2 people in 100 had some reaction that warranted physician attention. Even that is at the OPD level. 1 or 2 people in 1,000 may have some reaction for which they were admitted. But all this didn't have any significant impact. Everybody who had the vaccine is well and healthy, and there is no problem whatsoever. That's why from our standpoint, both yellow fever, Tdap, any of the vaccines we've issued so far, or we've been issuing so far, please be assured we've not had any significant reaction. And let me also add that Korle, we have all the top experts. Should there be any reaction beyond the usual, we have a team on the ground. The emergency tray is ever ready, and you have nothing to fear. Come to Korle International Vaccination Center. You'll be sorted out. No fears.
Right. Thank you. Thank you for that. There's a question online which is asking, Pat, please, is yellow fever still on the list? And for how many years? I don't understand that question too much, but if you do understand, then you can answer.
Yellow fever is on the list. It is 1 dose for life. So just taking 1 dose will be able to carry you throughout your lifetime.
Okay, so they don't need a booster.
No. They don't need a booster.
Okay.
Unless you have misplaced your record. You cannot produce evidence that has been vaccinated.
So since it's for life, if I have taken it but I do not have the records to show, and I take again, can I have any implications on my body?
No, please. It is safe. And in fact, the more vaccines you have, the better, without any side effects.
That is when it's dangerous, right? Okay.
Yes,
the more the better.
Yes, the more the better. With this issue of this yellow fever, if one cannot find the card, misplace the card, you just took the vaccine 3 months ago, 6 years ago, 10 years ago, and you don't be worried. The more the vaccine you have, you can have, I have had yellow fever vaccine about 3 or 4 times. The more vaccine of the same vaccine you have, the more the protection level. From 2016, there was the International Health Regulation, directive that from that time, everybody should receive the yellow fever vaccination once in a lifetime. But some countries, because of the peculiar issues they have, they will specifically say that every 10 years, people must receive the yellow fever vaccination. But remember, everywhere in the world, especially people going to or coming from Africa and Southern America, is mandatory to have at least 1 yellow fever vaccination.
Thank you so much. And I want to remind you that this webinar series is brought to you by the Public Relations Unit of the Korle Teaching Hospital. Production is done by Mawudaka Productions. Thank you so much for being part of the session. We'll continue with the discussion. Okay, before you add up, let me ask my question, then you add up and answer for me. What should our audience know about COVID-19? What are the new trends for travelers to know about COVID-19? Some countries still insisting that we come with our cards, or now we don't need it again at all? Okay, so before I answer that, with the yellow fever vaccination, those who took the vaccine before 2018, it used to be 10 years protection, but after 2018, it became for life. So if you have taken any yellow fever vaccine before 2018, that is where the 10 years comes in. But after 2018, whatever you take, the yellow fever vaccine you take is for life. So we should remember that. Okay. And to the COVID-19 protocols now, during traveling, now that we don't have COVID-19 vaccine in the system. Oh. So what you are required at the airport is you provide your COVID-19 vaccination card. That is if you've taken the vaccine previously. That is during 2021-22. Do we still need the card? Yes, you still need the card before you travel. Not at the Ghana airports, but at the foreign countries. They inspect it before they allow you to enter. So it's better you get your COVID-19 vaccination cards before you travel. Or you test for COVID negative results 3 days before traveling. So are we still testing for COVID before we travel? Yes, it's still recommended. Some countries require that. So you need to do that before you travel, depending on the country you are going and their requirements. Can we have an idea about the cost, or it might depend on the lab that you choose to do this test? It depends on the lab. For now, it used to be 350, but I don't know how much it costs now. Right. Dr. Amo, still on COVID-19, can you give us some more information on current trends? What's happening? I mean, also with international vaccination, being proactive with surveillance and all that. If other infections pandemics should come, how prepared are we? How have we positioned ourselves in terms of vaccination to be able to support the prevention and protection of our people? That's right. So the new trend in vaccination these days is formulating the vaccines in a manner that we have combination vaccines. So instead of you going your shoulder
or tie being jabbed 2, 3, 4 times. They combine the vaccines together. So once you have the vaccine, one shot, you would have gotten 6, 7, 8 vaccines, beautifully put together. So that's one innovation. Another innovation coming up these days is a new delivery approach, so that needle progressively is becoming an obsolete mode of giving vaccination. It is just patches. You put a patch on your shoulder, by 24 hours, the vaccine has entered into your system without the need of being vaccinated, being given the needle vaccination. So these are the frontier changes, and they are making the vaccination easier. They are finding ways of combining vaccine, making sure that the injection load is minimal, or avoiding the injection altogether. The latest ones coming now are the oral vaccination. So instead of jabbing or patches, you just take it by mouth. All of them to reduce the fear, the phobia, the hesitancy surrounding the injection. So the frontier is. Let me also add that as we handle pandemics, the system for protecting people using vaccine is becoming more and more efficient. Now, so for example, the HPV, to protect people against cervical cancer. This vaccine has been in the system since long. We use it for rich people, people who are rich and can afford. They are the people we use the HPV vaccine for. But being successful as a country in the way we delivered our COVID-19 vaccination exercise attracted the donors and support, so that we were giving the HPV vaccine to give for children between 9 and 14 years, which is a big innovation, a big trend to protect our future generation from cervical cancer. So all that is dovetailing to the fact that we are perfecting the system. Our surveillance system is becoming stronger and stronger. We are watching everybody and ensuring that we are protected. Korle International Vaccination Center is so strategically positioned, as a frontier vaccination center, and therefore, that is why we invite everybody from any part of the world to come over to us, for if they need any help, the latest in vaccination service and its surveillance arrangement will be made available to them.
Right. Thank you so much. I don't see any questions in the chat box. We are wrapping up soon. When we invite you to come to the Korle International Vaccination Center and have all the services that you require professionally delivered to you. Remember, it has been said over and over on the platform that we have skilled professionals to give you the skilled service that you need. And it is Korle Teaching Hospital where all the experts sit. And so when you are using a service in Korle Teaching Hospital, you know you're going for nothing but the best. Can we have the contact number of the center? There might be people who want to access the service and want to call before. Do we have a number that they can call?
Okay. So I will give my number, and then my sister will also give us. So if you want any assistance or information on international vaccines, you can call us on 0242 951209. 0242 951209, and every assistance will be given. Thank you.
Thank you.
Okay, so please, additional number 0244 1025 57 0244 102557. And please, we are located at the public health unit of the hospital. We are the old eye clinic where they have moved from. That is where we are located. We are open from Mondays to Fridays, 8:30 a.m. to 3:30 p.m. Aside these working hours too, we are available on call over the weekends, holidays. Terms and also conditions apply for these services.
Terms and conditions apply. Thank you. I have one in-house audience who wants to ask a question, and after that, we'll take your last words or take homes. So kindly be thinking of what you want us to take home with. I don't know if there's a microphone she can use. Is that a microphone she can? Okay, so please ask your question.
Thank you very much for the audience for the good work you have done today for Korle International Vaccination Center. And as we are there with International Vaccination Center and hepatitis B, supposing a client come today for the first shot, she's supposed to take the second dose in a month's time, and she's traveling. So what advice can you give? Will you be able to tell the client that because it's international, she can link up wherever she goes to take the second dose if she's not coming within one month?
Thank you.
Okay, so the question that was asked was, if a client has to travel before the month ends and has come for a vaccine like Hep B vaccine, which you have to take 3 doses to complete it. He's taking the first one, but cannot wait for the next bit of it. What can you do? Are you able to link them to any facility out there or advise them? Or does the documentation we do here, the yellow fever card that they hold, does it also allow them to continue the vaccine from wherever they find themselves?
Thank you. So they can start with the first dose. And in the record that we are issuing, there's a date for next booster. So we'll write the booster to be given in the following month. The date will be there. So anyone who sees it to know that the date is not up and you have traveled, so they'll be able to assist you to continue and complete. We'll write the next dose of the vaccination in your record, so you can carry it along, and they know that the date is not yet up for your subsequent dose, and that will be okay for your travel.
All right, thank you so much. There are some few questions online, so I want to quickly read them out for some quick answers before we wrap up. So Mr. John Babwedu is asking, I want to know, is there specific antigen to be immunized for a particular country, or yellow fever is the basic requirement for every country across the globe? Dr. Amo, if you can take that question for us.
Thank you very much. Yes, so yellow fever is the basic one across all persons living Africa and South America. When you are from this country, any country from these regions, it is compulsory to have the yellow fever card or yellow fever vaccination. But as we said again and again, each country has its own peculiar vaccines or routine vaccines that they require in addition to the yellow fever. And that is what we had told you earlier, that TDAP, polio sometimes, yes, meningococcal vaccines, and some others are required by specific country. Korle Teaching Hospital International Vaccination, that is what the professionals are here for. So when you tell us maybe you are going to UAE, you are going to any of the Gulf countries, you are going to Sweden, you are going to Canada, or US, or to South Africa, to any country you are going to, we are able to assess their current requirement in terms of the antigens you should have. And that is what we add to the yellow fever. We will suggest it to you. Once you agree, we will add so that you go there complete and without any problem. When we also realize that there are outbreaks in the places you are going, even if it is not part of their routine requirement, we would ensure that we will inform you accordingly. And if you are agreeable, what will protect you to go and come back safely, we would make it available for you. So,
thank you so much. I have some few comments and questions here. So we're having interesting discussion, very insightful session. Kudos to all. And yes, some special accolades to Sister Abigail Beautiful. And one also recognizing in charge, I am in charge part. Thank you so much. There are a few questions. Please, can one walk in for rabies vaccination? Is that possible? Rabies?
Rabies, okay. So with rabies, there's a protocol that you follow for rabies vaccination. The person should first report at a veterinary hospital where they are given the form to fill. And then they come to Korle Accident Center Pharmacy for the free government rabies vaccine. If you want to have the free one, you're also free to buy your own vaccine for us to administer to you.
Okay.
That's the protocol.
But the requirement is that you need to go to a veterinary hospital
to report
and fill a form. What is that for? Do you have any idea why so?
yeah.
That documentation.
Yeah, so those are incidental rabies vaccination. So if somebody has a dog bite, that's an incident, or a crow bite, or what's the name? Bat contact, and they are worried. And so that incident, after those incidents, you want to be vaccinated. That one you have to go to the veterinary center. They use those for their trackers, also for surveillance. So that's very important. Once that is given to you, you can come back to Korle. At the emergency, we have a free vaccine that you can pick up. But for those of you who are traveling to another country, and because you go to the rural areas of those countries, it's recommended in their protocol that you are covered with those vaccines. Those ones, yes, it's a walk-in, it's non-incidental, it is preventive. So you buy it, we will guide you where to get those vaccines, and we would issue those vaccines to you without any problem.
I know we are a bit behind time, but I want to ask, the rabies vaccine, are they easy accessible?
Yeah.
They are easy accessible, they don't go into shortage and all that?
No, they are always available.
Right. Someone is asking, someone is also asking about the prices or the price ranges for the various vaccines, if you can tell us about it. But before that, I want to read, so whilst you enter, answer, and they will also think about it. So you can take the vaccine way before even planning to travel, or you only need the vaccine some few months before you travel, especially the yellow fever vaccine. Someone wants to know, I think. So he's asking a question. Can you take it, even now that you are not thinking of traveling, so that if any opportunity comes, you have the card and you can go with it, or you have to wait when an opportunity comes and then you come for vaccination? I think that, yes, you can.
It is better to start.
Yes.
You should take it before travel. Prepare your...
Yeah, he just wants to ask if we can take it any time before you even have an evidence.
Yes, it can be taken any time.
Because we don't need a visa to prove, so you can take it
So
at any
earlier
time.
the better. It makes the stress of travel. You see people coming so tense and confused, and worried that they have to be given so many vaccinations within a short time. But it's far better a year before. Those in school now, this is the best opportunity for you to have. Medical students, you will have your travel outside for your, student, what do you call it? Exchange programs. It's so important that now, get involved. Yellow fever is for life. TDA, by the time you have the second dose, is for life. Varicella is for life. So, the earlier the better, stress-free, the cost is manageable, you can spread it and do the vaccination at your convenience, no stresses at all. Earlier, the better.
Right. So the price range, if you can give us an idea.
Okay, for the prices, all that we can say about the prices is affordable. Very, very, very affordable.
The lowest.
The lowest among all. So you can call the contacts we gave out, and then we'll give you out the prizes.
Right, so very, very competitive prizes.
Yes.
Call the numbers that we're giving out, and they'll give you all the information that you need. Someone is asking, what do you do if you miss the period for hepatitis B vaccine? So you've taken the first dose, the next dose you've missed it. What should you do?
For hepatitis B vaccine, the second dose is crucial. So missing that is very, 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 very not acceptable. You should continue at the correct interval. For the third dose, it's up to 1 year, but second dose is within 1 month, maximum of 6 weeks. You shouldn't exceed the 6 weeks.
So in cases that it happens, what happens?
So when it happens like that, you'll be tested again at the facility to prove whether you are negative, and then we start the vaccination again.
Wow, so if you go beyond the 1 month, 6 weeks, then we'll have to start it all over again.
All over again.
Right.
Yeah. So let them know the sequence. You take the hepatitis B vaccination today. The second dose is after
Exactly.
4 weeks, 1 month.
month, yeah.
And then the third dose is 6 months.
Yes.
The 1 month one from the day you started is the most crucial.
Yes.
If you don't come 1 month, 2 months, 3 months, you don't come, ashegu. You, when you come, we'll test you and restart. So you start again 1 month, and then 6 months, so that you can be protected.
Right. Thank you so much. Before we wrap up, before you give your last words, I want you to share with us, what are some of your experiences? Because I know you used to do a lot of follow-up calls for people to come for their vaccines. Share with us what your experiences have been with these follow-up calls.
Okay, thank you. Sometimes we are able to get them to come when we call them or even text them on their phones. Other times too, they tend to forget the date. Even after calling them to remind them, they may have other excuses. Financial constraints, time constraints, they have traveled out of the country, or they are in other regions in the same country. They are not able to make it. So these are some of our challenges with the follow-up that normally we do.
Right. Dr. Mo, I just want to ask quickly, what are some of the strategies we can put or you have in place to ensure that all the people that come to us for first doses or vaccines will be able to come back again for the subsequent vaccines?
So you're right. So vaccination is preventive in its orientation. The person is not ill. There's nothing telling the person that there's imminent danger. So there is generally low motivation for most people to, again, bother themselves, come all the way to Korle. So what we normally do is to do what is called motivational interviewing. That is, counsel the human being the first dose, at the first dose, encourage them, increase their motivation level for them to see the need. When we call and there is problem, and we realize that, for example, hepatitis B, time is running out, we send them to the nearest facility to continue, so that if for some reason they have traveled out, they are not close by, then they can have those vaccination. But in experience, we've realized that when you give people enough motivation, reason for, taking discomfort and come over, and they understand. I mean, human beings generally would oblige and sacrifice and complete the process.
Right. Thank you so much. So we are wrapping up. Thank you. We are over 23 minutes over our time. But our audience are still interested in the prices of the vaccine. So perhaps you can give them an idea. How much will it cost to take any of the vaccines? For instance, the yellow fever, basic, how much is the cost for yellow fever vaccine?
Yellow fever vaccination and the card for travel is 90 cedis only. 90
cedis only?
Yes, please.
Right.
And if you are transferring a record from your small card to the international card, it will cost you only 80 cedis. 80 cedis only for transfer of your record.
So if someone has taken the vaccine and wants the new or the international card, they'll have to pay 80 cedis for that transfer.
Yes, please.
All right. But missing card, you can't get a new card.
No, please.
So I wanted to ask, the records, I'm sorry for going over the time, but the records that you keep at the unit, I might have vaccinated and lost my card. Can I come back? Will you be able to find my information in your records so that you can still issue me a card because you have that record to actually go through and confirm that I have taken this? Do you keep such records at the outfit?
Yes, we do. So once we did the vaccination for you, we have your records intact. If you come back years later, you get a record back.
Right.
That's the exceptional service we provide. Even the COVID, all the 67,000 people, I mean, others have lost their record. We have everybody data up to the minute. Once you come, we check your name, it will pop up at all costs.
Right.
Yeah, so no problem.
So if you are out there and you've vaccinated the Korle Teaching Hospital and have lost your yellow fever card, kindly come. We'll look out for the data in our system. So the record, as has been confirmed here, is well kept, it's secured. We'll go through, get your information, and then issue you with a card. Don't ask me if it comes with a cost now. When you get there, they'll explain everything else to you. Thank you so much. I don't know if you have, in 1 minute, if you have any final words to say in 1 minute.
Okay, so what I want to say is, these vaccine-preventable diseases, the cost is very, very less than getting the disease, because treatments for these diseases cost a lot. Some doesn't even have treatments at all.
Well,
so it's better you get vaccinated than to get the disease. That's all.
Prevention is better than cure.
Yeah.
Right.
Yeah. So that for vaccination of any kind, local vaccination, travel vaccination, there's only one place. The whole world, the whole Ghana, there is only one place. Korle International Vaccination Center. We are ready for you. Please, corporate organizations, groups, pilgrimage, schools, international schools in Ghana. Tell your PTA chairman and what have you. You need those kind of international vaccination services. We are ready. Affordable government, low price, but extreme rigor and excellence. And you will enjoy, you come with that. Our arms are open, please. Why are you waiting? Come over.
All right, Pat.
Yes, please. We are waiting to have you because we have the best customer service delivery at our end. We want you to come for that experience. That will leave that impression on you, that you always want to come back to us for more vaccinations.
Right.
So please try and come to Korle. We are open for you.
Thank you so much. And Dr. Moore has rightfully done that advert for the International Vaccination Center. So no doubt, come to the Korle Teaching Hospital for all your travel needs in terms of vaccination and travel advisory services. And we were privileged today to have this discussion led by Dr. Philip Amo, the head of the Public Health Unit, Korle Teaching Hospital, our sister patients, Korle, the lead for the International Vaccination Services, and our sister Abigail Owusu, who is also the lead disease control officer for Korle Teaching Hospital. My name is Hannah J. Mensah, and I moderated the session for you. We are privileged to the Public Relations Unit of Korle Teaching Hospital for this insightful webinar series that they have initiated to educate the public on the services available, important information on health that you will need anytime in your life. And very, very grateful to Mawodeka Productions for always being there to support us with our live streaming of this event. Thank you, our online audience. Thank you, our in-house audience, for also spending time with us. Until we meet again, enjoy your evening, have a great time, and don't forget to recommend the Korle International Vaccination Center to a friend, to a family, to a colleague. Enjoy your evening. Bye for now.